This video is aimed at nurses, general practitioners and other prescribers who work with older people in Northern Ireland. Antibiotics can cause harm to older people. They can cause Clostridium difficile infection, resistant infections, drug reactions, and this video aims to help you know when antibiotics might be needed for suspected urinary tract infection.
So the diagnosis of urinary tract infection can pose quite a lot of difficulties, especially in the elder population.
The Public Health Agency has produced a new decision aid, which is a flowchart to be used by people who work in care homes and nursing homes and by GPs to come to a decision about whether somebody might have a urinary tract infection, what investigations would be appropriate, and whether or not treatment might be required. The last page of the document contains a checklist which care homes can use to document their observations and their decisions. If a patient has a measured fever on at least 2 occasions in the last 12 hours, then he or she may have an infection. If there are any signs or symptoms that suggest that the infection might be arising from a different part of the body, like the chest or the abdomen or the skin, then this decision aid isn't intended for that purpose, and care homes should contact the clinician as they normally would. For people who have a urinary catheter, any of the following might suggest a urinary infection: shivering chills or rigors, new costovertebral or central low back tenderness, or new or worsening of confusion or agitation. For people who do not have a urinary catheter in, then 2 or more of the following symptoms suggest a urinary infection: pain on urination, an urgent need to urinate, frequent need to urinate, new or worsening urinary incontinence, shaking chills or rigors, pain in the side of the body or above the pubic bone, visible blood in the urine, or new or worsening confusion or agitation. Follow the flowchart and document your decisions in the checklist at the back of the pack.
So in diagnosing urinary tract infections in the elderly population, a urine dipstick is not a useful examination. Do not dipstick the urine. Send the urine for culture. Only send the urine for culture if the patient has symptoms and signs that are convincing of a urinary tract infection. When we have urinary tract infections diagnosed using dipsticks inappropriately, we end up with a lot of inappropriate antibiotic exposure for these patients. This really drives antibiotic resistance, and more these days we are seeing resistant urinary coliforms in the elder population, which are becoming more and more difficult to treat. For treatment advice and for advice on investigating urinary tract infections in this age group, please refer to the Northern Ireland Primary Care Policy